for the 16 centimeter CTDI phantom. I've already mentioned that, well, what do we call this dose that we're estimating? We call it SSDE. It stands for size-specific dose estimate. We believe it's accurate to 20%. It is an estimate. And as a result of that, results need to be reported with a reasonable number of significant digits. We're recommending that if the SSDE is greater than 5 milligray, that only a whole number integer is presented, and if it's less than 5 milligray, 1 decimal place is probably appropriate. TG204 also has a recommendation as shown here for dose reporting by radiologists. As you know, doses have to be reported today in California. Most people today are reporting CTDI vol because that's what they have. If you read this statement carefully, where everything that's highlighted, the dictator, while they're interpreting the images, needs to make a choice. But if you make a choice and specify all those things, 5 years later you can look at the patient's medical record and understand exactly what the dose number that's put in the line for milligray actually represents. It's the SSDE, and the assumptions that were made in coming to it are listed. What about a couple just sample calculations? We can measure the dimension of the patient on the pre-scan projection scan, and in this case it's 16.8 centimeters. In this case, the